people talk about chatbots, and chatbots kind of just do a limited amount of. We're really talking about virtual assistants, which is extending the functionality not only of DRUID, but UiPath on the back end to actually do activities that puts the whole solution together.
I'm Stephen Gerhardt, Managing Partner and CEO of Element Blue, and I'm here with Joe Nieto and Daniel from DRUID, and we're just going to talk a little bit about today our solution, Element Blue, and DRUID's partnership with Texas Children's. The first thing I'd love to ask Joe, and Joe is Director of Healthcare, Element Blue's Engagement Manager on these projects with Texas Children's. With using the DRUID technology, we started with a real interesting problem around the COVID global pandemic, right? And just tell us from the top, like what through that pandemic we did with the employee-facing solution to solve for a challenge of bringing those employees back through chatbot, conversational AI technology. Maybe you can tell us even the difference of what conversational AI, virtual assistants, and chatbots always really mean. So.
Absolutely, glad to do that. So some of the first challenges that we addressed with during the COVID era was how in healthcare, the requirement from the CDC was we've got to get everybody in the hospital, and that means everybody, not even frontline, not only frontline, but backline, the facilities people, the food workers, everybody had to get vaccinated. Not only that, we had to collect all the documentation to go to prove to the CDC that we're compliant. So how do we get that information to employee health, which is our target customer group? How do we get that information to them in the most efficient way possible, as quickly as possible, and in ways that makes it easier for the employees to do so?
Yeah, I mean they were using a lot of contractors prior to that, right?
Absolutely. The last time they had an exercise close to this, which was the influenza, or really collecting any of the vaccines, they have to hire about 100 temp workers, contractors, to come in to work the phones, fill out the forms, and basically chase down employees to kind of gather the information. And it's a long process. It's a long manual process.
Yeah. So you find Daniel here. We find chatbot technology. We had been using chatbot technology with another provider. I mean, we frankly had been doing some things with Amazon for years. But this partnership between the UiPath solution that was already there,
right?
Your seamless integration, right? And then, so now, but the difference between chatbot and virtual assistant, I mean, that kind of goes to the automation UiPath piece of it, right?
Exactly. Yep. And to put those two terms together, people talk about chatbots, and chatbots kind of just do a limited amount of. We're really talking about virtual assistants, which is extending the functionality not only of DRUID, but UiPath on the back end to actually do activities that puts the whole solution together.
Yeah. Well, like you're saying, feeding data into the occupational health management system. Absolutely. That's done by some robots. That's done by some automation.
Yeah, because at the end, the backend applications needs to handle the data captured by the bot. So you have the backend applications, but you need a mechanism to surface in the front of the end users. So this way you transform the backend operations into conversational business applications.
Absolutely.
So that's more than a chatbot.
Yeah, absolutely. And I think it's important for folks to understand how that technology marries together.
Yeah.
The other thing we want to talk about is a little bit within healthcare. We had security, regulation, the moat of getting across the bridge to, the protected hedge that they have against everything, right? This was going to be a public-facing solution, even for the employee side, right? Yep. Tell me a little bit about the challenges with security and compliance.
Sure. So part of the challenges is because we are dealing with health information, there's rules and regulations that go along with that, patient information, all the information has to be secure. And DRUID does a wonderful job of making sure that the data is encrypted. And the other, to talk about that moat we have to get through, is to open the doors and work with a hospital, with the infrastructure team, so that they understand the mission of the virtual assistant, understand the mission, understand what we're trying to do, the constraints that we're under with CDC guidelines, right? We're trying to be compliant, but find it in a safe way to get that data that works for everybody.
And the deployment options with this flexibility.
Exactly.
I know that all of us are looking in the cloud, all the capacity in the cloud, but sometimes you need also on-premise food.
Exactly.
And this, I remember the hospital appreciated very much the infrastructure, deploying the entire DRUID technology on-premise, running on their servers.
Yes.
So they were relaxed, all
Yes.
good, nothing in the cloud.
Yes.
So
Yeah.
they appreciate it.
Yes, absolutely.
That brings up a point. You guys have a cloud option. We went the on-premise option, but there's also scaling and performance that we had to balance in that, right?
Yeah, the beauty of this technology is that the same technology piece can be deployed in the cloud, on-premise, with all the scaling capabilities. I remember the first bot facing a couple thousand of employees,
Yep.
but the last bot was 20,000 employees
Yes.
jumping into the bot. We had some performance at the beginning.
Right.
This with the 20,000,
Yep.
all good, flat, immediate response times,
Yep.
all people relaxed.
I remember there's some lessons learned there, right?
Yeah.
With just trying to scale infrastructure in a partnership with them, learning basically a little bit of technology as well.
Piloting at the beginning and then activating auto scaling, all good
Right.
at the end.
And I think that goes to the strength of the partnership here,
Right.
because this is going to be a learning process. It's a learning process for the hospital. It's a learning process for us. It's a learning process for you. And this was kind of a unique situation, and we would like to say everything always runs perfect the first time, but it doesn't always.
not the case,
And the strength of the partnership is, how do you respond when you stumble, right? So we had some surge events that we identified quickly. We got our heads together. We were able to scale up to handle the increased traffic. It worked perfectly.
I
Absolutely.
enjoy it very much, and all this feedback going back and forth between us, you, and the hospital.
Yes.
And I remember all the team putting the time together.
Yeah.
Some late nights as well.
Some late nights.
A few late nights, I heard. Yeah.
Good.
Yeah.
Well, we found through that some patient-facing opportunity as well, and now we're helping them actually scale an entire telehealth virtual
Yep.
visit service center
Yep.
with this technology. I mean, it's extremely exciting, I think, for us, right, to
Yeah,
be jumping into
absolutely.
this.
Absolutely. So the great thing about this, when we've been talking about COVID, but COVID wasn't our first chatbot or virtual assistant. The very first virtual assistant was for the telemed group to help them work through the speaker test, the mic test, the camera test, to have patients that are coming up for the telemedicine appointment, to help them troubleshoot those issues. So when they actually get into the visit, that the provider, the doctor, and aren't trying to fix technical questions that should have already been solved before, right? So once we got that door open, we got a lot of interest going, well, what else can we do? And so now we're working on the rooming process, which is the next evolution, the next skill of the virtual assistant, which is, hey, I'm doing a good job of checking your equipment. Why don't I go ahead and ask you what your weight is, your temperature? Are you still taking the same medicines that I have on my records? It becomes more conversational, because that helps the physician's assistant and the medical assistants. So when the appointment comes in, they've already gone through those questions, and they can review them quickly with the patients and get them on their way to the appointment.
And this is really cool because the same conversational AI installation was able to service external users, the patients,
Yes.
and then internal users, the employees.
That's absolutely right.
And this is very good because it's the same installation, the same technology,
Yeah.
and connecting to different systems.
Right.
So you are consistent within the organization.
Right.
Yeah.
Yep. And
I mean, go ahead.
oh, I was going to say, and to build on the technology, and it's something that gets skipped, is that it's just not English.
Yeah.
It's multilingual, it's multicultural,
Right.
right? So when we're talking to the patients, not only can we converse with them in English, but there's patients that are Spanish that are speaking Mandarin, for example, or French, Chinese. We can do all those languages. Same engine, same platform, same infrastructure, same product.
I remember when we onboarded machine translation functionality within the bot. That's really
Yes.
cool, yeah.
And that broke down some barriers, right? Patients that are new to the healthcare system here in the U.S. can get service, and it's in their language, and they feel comfortable. Yes.
We wanted to summarize a little bit about how I think, frankly, just easy it was to work with you guys to scale this solution and get it in, and just a representation of being a partner first company, right? Like, I mean,
This is
jumping
this is
into the
our
middle of
focus
night.
and love
Yeah.
to work with partners, and I appreciate your help.
Yep.
It's hard work from your side, but for ours as well. So you write me an email that you say, I will go in any war with you guys.
That's right.
So
Yeah.
we
That's
really
right, we've done
enjoy,
that, yeah.
and we love to be on the field with you.
Yeah.
And we enjoy when you give us challenges and the opportunity to address.
And the barrier of you're in Romania, we're in Texas. I mean,
no
it didn't
worries.
matter, right?
Yeah,
like we
exactly,
were figuring
exactly.
out a way
Yeah.
to
And
make
now
this happen.
It will be
So
even better. We have our US team in here.
Yeah.
We are
Yes.
already 15 people now.
absolutely.
But still, the Bucharest team is who are.
Yeah,
That's right.
We
Yeah.
are troopers. So.
Yeah.
Absolutely.
Yeah.
And same with our UiPath partnership, and that ecosystem brought us together, obviously. So cool,
Yeah.
very good. Well, thank you.
Appreciate very much.
Yeah.
Thank you.